And we are live. Awesome. Welcome, everyone. Thanks for joining us again this evening for part 2 with Dr. Shaunagh Emanuel. Nice to have you again. And I think I'm very excited to continue our conversation from last week because it was very, very interesting. We've had a lot of people reach out to us and give us some feedback on how much they appreciated that. So welcome back, Doctor.
Thank you. Thanks for having me.
Yeah, no, I'm glad you're back. I really, truly appreciate talking to you because it's such a topical, such a relevant topic, and it's nice to be able to have an expert in your field talk to us so that we can get this insight. And I think, especially for me as a parent, it's a anxiety. It gives you a lot of anxiety when you have to try and figure out what to do. And what you shared with us last week is just really nice. It takes off a lot of pressure and it gives you next steps and just what we can do for ourselves or any of our loved ones that are dealing with allergies. So we're continuing that conversation tonight, but we're talking specifically on seasonal allergies and what the symptoms are. So if you're just joining us, swipe in. I am over on the Jeff Together and Jeff page, and we're also streaming over to our partners at Cipla on their Facebook page. So welcome to everyone on that side as well. And please feel free, everyone who is swiping in and joining us, to make sure that you leave your questions in the comments so we can actually see what you have to ask. So we're going to get through a few questions with Doctor here today, and then if you have any questions, just let us know. Okay, let me just find us quickly on this side. Okay, fantastic. Awesome. There's a few people that are there. Hi, everyone. Thanks for joining us. And just keep starting in. Let us know you're here. All right. So I think because we want to cover quite a bit, I had a community member reach out to me oopsie, I think is my internet frozen. Sorry about that. I had a community member who reached out to me and asked a question directly that she wanted to ask you. So I'm going to just go straight ahead and ask that. She said, "Hi, Coach Tash. I watched the Tuesday Ed on allergies. Thank you so much for tackling this subject. I was hoping you could perhaps put this to Dr. Emanuel for next week, please. If possible, could she please chat about options for desensitizing? I've heard bits and pieces about this possibility, but nothing concrete, so I don't know if or how to go about it." She said, "My son and I single-handedly keep the antihistamine droppers in business. For sure going to try Effecto. And my daughter is allergic to bee stings." So I'm not sure. Did you get all of that? I'm so sorry. I see my internet's cutting out a bit.
That's okay. I didn't get there was a little bit at the end that I missed, but I think I can answer the question. So we did talk about, what allergy is and the sort of usual treatments of allergy before. And typically what people treat allergies with is antihistamines and steroids. But none of those medications are actually cures. They're just really symptom managers. The only real way that you can an actual cure in allergy is immunotherapy, which is desensitization. So if somebody's allergic to something like, say, house dust mite or pollen, for instance, they can get immunotherapy against that particular allergen. And what happens is that you actually, in a sense, bombard the immune system with that exact allergen to such an extent that you actually develop tolerance. This is very, very effectively done with bee stings. Bee sting immunotherapy is practiced everywhere in the world, and it's extremely effective. It's over 90%, over 95% effective. And essentially, once you finish the program, which takes about 3 years, but at the beginning it's quite intense, and then it just spreads out and spreads out. So over a period of 3 years, you do develop tolerance if it's successful to essentially the same dose as 2 bee stings. And so, if a patient is extremely allergic to bees and develops anaphylaxis to bee sting, then it's a very powerful way of managing it. Because if they are stung by a bee in the future, even if they may develop an allergic reaction, the chance of them developing anaphylaxis is very unlikely. The thing is that immunotherapy to things like grasses and say house dust mite in this country, it's not very well set up because it has to be specially ordered for each patient. It's not registered, so it has to be ordered on a sort of Section 21 basis. So there are only really a few units that do it. So in Cape Town, the allergy unit does it, and there are doctors that I know in Joburg that do it. But because it's quite administratively heavy, most of the patients that do participate in immunotherapy, which is quite a commitment also because it takes a few years, generally are referred to those centers that are used to doing it and have a system that's up and running so that it's easier for them to do it. But in a patient where you've chosen the right kind of patient, they have symptoms that are too severe to be managed by normal nasal sprays and antihistamines. If it's a patient who's not sensitive to a huge plethora of different allergens, but one or two allergens that can be specifically targeted, then it's an extremely powerful way of treating them, because you can essentially effect a cure through initiating tolerance.
Wow, thank you so much. That was Noelle's question. So Noelle, I'll pop your question in the comments there as well for others to see it, because I cut out in the beginning, and then you guys can hear the answer that Doctor shared here. So actually tonight we're talking about seasonal allergies specifically. So we're just going to go straight into it now. Doctor, what is nasal congestion?
Well, nasal congestion is essentially a blocked nose, but there's a whole lot more to the nose than you knows. So essentially the nose is a little protrusion on your face, but behind that little protrusion and behind your nostrils is a very big space. And that space is lined by a membrane. It's called a mucous membrane, and it folds over on itself so that it causes, it actually ends up being a very big surface area. And that mucous membrane contains goblet cells and is very, very well supplied by blood vessels. And it's linked to the sinuses and to the ears and to the throat. So it behaves as an air conditioner. It humidifies the air and warms the air that's going into the lungs. And it's also our first line of defense against microbes or particles entering the nose. So there are hairs, the membrane itself, the mucus, the tiny little hair-like protrusions that form a kind of wheat field on top of that mucous membrane. And then the immune cells themselves that sit within the mucous membrane all form the first line of defense against anything sort of threatening that might be entering your body through the nostrils. So when you talk about a blocked nose, actually the blockness is coming from three separate aspects. One is that mucous membrane swells. So you get enormous swelling of this huge membrane that's folded up upon itself. So instead of it being sort of like a sheet lining that nasal cavity, it becomes like a thick duvet. And then on top of that, those little blood vessels, which part of the swelling is caused by these blood vessels dilating up, the blood vessels under the mucous membrane, and they produce a lot of fluid. So that fluid leaks out of that mucous membrane into the space that is formed, behind your nostrils, which is the nasal cavity. And on top of that, the goblet cells produce mucus. So you've got a mixture of fluid plus mucus plus a swollen membrane. That's what a blocked nose is. So it is quite a serious business, a blocked nose, and it takes it depends on what causes it as to how to treat it and so on. But a blocked nose is more complex than just a bit of mucus in your nose.
Sure. Okay. And so you touched on it, but what causes most common nasal congestion?
Okay, so nasal congestion could be caused by an infection. You could have a bacterial infection in the nose or a viral infection. Most commonly, it's a viral infection, and that would be a common cold. And that's what gives you your runny nose or your blocked nose when you get a common cold. But you can have allergic causes. So the usual things that set up a blocked or runny nose in an allergy would be things like pollens, house dust mite, animal dander, or molds. And then you have lots of non-allergic causes for a runny nose, and people are not really aware of this usually. They sort of think, well, if I've got a blocked nose and it's not a virus, it must be allergy. But there are lots of reasons why you can have blocked nose which are not based on allergy. For instance, age can be an important cause of blocked nose. As people get older, they end up having very often in this very later on in life, you end up with a sort of a runny nose. Elderly people just have an ongoing runny nose. It's quite common. Hormones can cause a blocked nose or a runny nose. So you get a runny nose or blocked nose of pregnancy. Medications like, or there are various medications that cause blocked noses. Chemicals like, for instance, perfume might cause a blocked or runny nose. A sudden change in light or sudden change in temperature, just driving out of a dark garage into the bright light of the morning can set a runny nose off. So that's called vasomotor rhinitis. I'm sure lots of people who exercise really, they run out of their house in the morning into the cold air, start breathing cold air quickly, and suddenly their nose starts dripping. And their snoot is just not enough to catch all of the mucus that they produce. That is called vasomotor rhinitis. Then there are physiological reasons why you could have a blocked nose. So your mucus might be just not the right thickness. There's a condition called cystic fibrosis where mucus is actually just a little bit thicker than usual, and those patients end up with chronic blocked noses. Those little cilia, those tiny little hairs that are sort of on top of the cells that form the mucous membrane, they usually sort of look like they're blowing in the wind, like a wheat field blows in the wind. They're very coordinated and they all go in the same direction, always bringing the mucus up towards the nose. So even right down from the lung, all the way up the throat, into the...
Oops. Did I lose? Oops, daisy. I think we lost the doctor. I thought it was on my side because my internet's not been the greatest.
Okay.
There you are. There you're back. Thank you.
Yeah.
Okay.
so uncoordinated cilia can cause a blocked nose or a runny nose. And then a weak immune system, immunoglobulin A, immunoglobulin G, IgM, all of those are very important immunoglobulins working hard at the nasal level to prevent infection. And if you have a weak immune system, you might end up with a blocked nose much more commonly. And then mechanical obstruction. So something that's actually blocking the nose itself, like if the septum is deviated. So, the septum is that little piece of cartilage between the two nostrils. If that moves over into one side, you can end up with a blocked nose because you don't get proper drainage. Or a foreign body like a peanut or a little piece of Lego stuck up the nose. It has been living there for a few months. Very common cause. Polyps block the nose, masses, tumors, all of these things can give you a blocked nose. So a blocked nose, as you can see, has many causes. But typically, if it's not a common cold, it's usually allergies. Those would be the two very common causes. But when a patient sort of sees you with a blocked nose, it's really important to bear in mind all of those other causes as a differential diagnosis.
Awesome.
Actually, I also wanted to mention another thing, is that that mucous membrane that lines the nose also sort of goes all the way down the throat and into the lungs. And so it's the same style of mucous membrane, has those little cilia, produces mucus. It's that ciliated sort of columnar epithelium, which is a special kind of epithelium or a special kind of lining that lines all the way down to the base of the airways. And so whatever's happening in the nose is often happening in the lungs. So, patients with allergic rhinitis also often have asthma or the other way around. So it's important always to think of the airway as a kind of united airway, not to just treat the nose or just treat the lungs, but to realize that they are connected, and they're connected mechanically just because, from the point of view of the mucous membrane being linked, but also from a neurological point of view and also an immune point of view, they are very connected. So it is important to always treat the nose and the lungs together.
And the ears as well. And hence why the ear, nose, and throat specialist. So that's
absolutely
awesome. Okay, so what are some ways that we can treat nasal congestion then as well?
Well, that depends on the cause. Obviously, if it's infective, if you had a bacterial infection, you treat it completely differently to if you had allergies, for instance. But for instance, if we're managing allergies, the aim is to settle inflammation. So that the whole process that is set up with this mucous membrane producing all this fluid, etc., is all an inflammatory process. So the whole sort of basis for the management is to manage inflammation and thereby turn off the taps and prevent the congestion. Helpful measures include things like avoiding allergens. It's not always easy if you're allergic to, say, house dust mite, or if you're allergic to pollens. It's almost impossible to avoid those. But if you're allergic to horses, that can be more managed. If you're allergic to cats, for instance, but avoiding allergens is one aspect. Humidifying the air, warm showers, hydration, staying properly hydrated so the mucus doesn't become sticky and thick. Warm drinks that warm up the nasal passages when you drink them. Saline nasal washouts are very effective. So those are sort of general measures that are not sort of essentially medical measures, but they are helpful. And then essentially when we treat allergies, we use a steroid nasal spray and an antihistamine as our sort of first line of attack. And then, we at the beginning, we mentioned this immunotherapy, and immunotherapy is definitely part of this picture if you've got the right kind of patient. But normally what you start off with is a steroid nasal spray to just get that inflammation settled, and then use antihistamines if and when needed for sort of the itchy, runny aspect of the symptoms. Acute congestion also is part of the picture sometimes. So you might end up with a patient who has a kind of quite consistent symptoms, very well managed with their nasal spray, use antihistamines every now and again when they need them, or even might be on antihistamines every day. But then they just, they go away for the weekend and they stay in a place which has been locked up for a while, it's full of house dust mite, and their nose is just impossibly runny and blocked. And they just need something to sort themselves out quickly for a couple of days, Then it can be quite useful to use a decongestant. And you can get decongestants that are topical, or you can find them actually orally in cold and flu medication, like Corix, for instance. But a topical decongestant can be very useful for a patient with allergies, even though it's just for a couple of days. The topical decongestants cause those blood vessels underneath that mucous membrane to constrict up. And when they constrict up quickly, they stop leaking. And as a result, the puffiness settles, and then you stop producing all that fluid. And it can be quite an effective way of very quickly, as I say, turning off those taps. So a nasal decongestant is helpful for acute congestion, but it should only be used for about 3 to 5 days.
Awesome. Yeah, and I think you actually touched on that already, like patients that are suffering from congestion need to remember to only use that decongestant for 3 to 5 days. Don't overdo it, because then you might actually cause some harm to yourself. And the body reacts and it tells you what it needs to tell you. So if you use a plaster for too long, you might actually be covering up some of those symptoms. So you need to get to the bottom of what those symptoms are trying to tell you as well. So when should you get medical advice when suffering from a blocked nose then?
Well, a blocked nose could be acute or chronic. If it's acute congestion, then it would typically be a common cold. So you have no congestion at all, you're not a person with allergies, and then all of a sudden you come down with a series of symptoms, maybe a bit of a fever, a bit of a headache, and suddenly your nose is blocked. That kind of acute situation would be treated symptomatically as a common cold. But it's when you have chronic congestion that you require medical attention usually. And, we discussed causes, but the common causes would be allergies, and that's a very good reason to seek treatment. But even non-allergic causes like vasomotor rhinitis, infections where you have like a bacterial sinusitis, where patients will usually have pain and fever associated with their blocked nose, and a discharge which might be discolored or thick. A foreign body, like, as I was saying, a little piece of Lego stuck in the nose, or physiological causes that give you thick mucus like cystic fibrosis. All of those causes of chronic congestion should be sort of a diagnosis really needs to be made to initiate the appropriate treatment, and the treatment is different in each case. The trouble with chronic congestion is that essentially the respiratory tract is plugged at the top. And so it feels like you've got a common cold every day, and it's really a very uncomfortable situation. It impacts heavily on breathing, and it really affects quality of life in patients. It affects adults, productivity at work, and it affects children's ability to concentrate at school. It affects sleep in a very sort of impactful way. So children need to sleep deeply right through the night in order to grow. And so it affects children's growth in the long term. And particularly in teenagers, it's important that they close their mouths when their faces are busy forming. So, you get facial deformities, mouth deformities, teeth development issues, malocclusion of the teeth because they don't close properly, because they've never been closed, because they're constantly breathing through their mouths, because actually they've got a blocked nasal passages, so they can't breathe through their noses, and the result of this constantly open mouth ends up giving teenagers what we call atopic faces. It's a kind of elongated face, and they spend a lot of time at the orthodontist. And then it affects sport and exercise. So it's difficult to exercise at all when you've got a blocked nose. Breathing is kind of essential for the whole process. And then also it's difficult to exercise at a high level. People who are exercising at highly competitive level really struggle if they haven't got really sort of well aerated nasal passages. So it really is highly impactful at that level. And then, of course, probably the part that irritates people most is that it heavily impacts on their social lives. It's very, very difficult to communicate, to kiss anybody, to chat to somebody, to just have a conversation. If your nose is constantly blocked or runny, it sort of feels like, you've got a packet on your head all the time, so you can't quite really kind of express yourself. So people really struggle with that aspect of it. You did touch on it, but I also just want to mention that condition that we call rebound congestion. It's also called rhinitis medicamentosa because it's a runny nose that's caused by overuse of medication. So that's where the medicamentosa comes in. And what happens is some people, because they find the nasal congestion nasal spray very effective, get into the habit of using it every day. And this interferes with your natural regulatory mechanisms in the nose. And after a while, the mucous membrane produces mucus in a continuous stream and fails to stop at all. So you just have this ongoing runny nose. So eventually you can't go without your nasal decongestant spray because of overuse of your nasal spray. So remember, do not use a nasal decongestant for more than about 3 to 5 days at a time. They are absolutely brilliant. They work fantastically. They just mustn't be overused.
Yeah. Awesome. Thank you. That's fantastic. All right. And then I think we need to go on to the next question. Can you use a nasal decongestant, in combination with allergy products like an antihistamine? You've touched on it a little bit already. And I think, just going off of the last statement that you made for the rebound congestion as well, what would your recommendation be?
So typically with somebody with allergic rhinitis, they would be on a nasal spray. It would be a cortisone nasal spray. They use it absolutely every day. It's a controller. So I have a little poem that says, if you don't use it every day, you might as well throw it away. So it must be used as a consistent background medication. And then they would be on an antihistamine on a regular basis, semi-regular basis. It just depends on what sort of symptoms they have. So those would be their usual medications, but you can very easily add a decongestant when needed to that background medication. So yes, they make a very good combination. Just the important thing is that the chronic medication, happily, you can use a nasal spray and antihistamines chronically, but you can't use decongestants chronically. Stick to that 3 to 5 days. It's really important to remember that.
Awesome. That's so good. So when you have acute, you can use it for that time period. But if you have chronic, try and speak to your doctor about other options. Okay. Cool.
Yeah, that's right.
Okay, awesome. Okay, so what is a good nasal decongestant that is currently on the market?
There are several nasal decongestant. One that I'm familiar with is and use and find very sort of soothing, actually, is Oxymist. It is a great option if treatment with a nasal decongestant is indicated and as long as it's used as directed. First of all, there are two different sprays. So one is specifically suited to adults and one which is specifically suited to children. And this is very convenient. And another nice thing about it is that it's fast acting. So it relieves a blocked nose within about 25 seconds. And then also the decongestant action is long lasting. It lasts for up to 12 hours. And of importance is that it has a moisturizing effect. So it doesn't dry the nose out. Sometimes the decongestants actually kind of feel a little bit burny inside the nose, whereas this one, because of this moisturizing effect, it doesn't dry out and feel burny. So I think Oxymist is a good option.
Awesome. That's amazing. Thank you so much. And then, yeah, I think you've covered all of our questions, haven't you? Well done. That was quite quick as well. So let me say hi. There's Iva is there. Hi, Iva. Hi, Angie. And hi, Auntie Pat. Nice to see you all. If there's anyone else who has joined us, please make sure to comment and say hi. And then also, don't forget to leave your questions in the comments. And then, Doctor, I'm sure I can tag in this. And if anyone has any questions for you or want to contact you about a consultation as well, they're more than welcome to do that as well. So yeah, I think I don't see any questions coming through. We might actually have wrapped earlier tonight. So if there's anything else, any additional thoughts that you have, Doctor, by all means.
Well, one of the questions that people often ask is, do you need a prescription for allergy medication, or can you get allergy medication over the counter? Yes. So some allergy medications do actually need a prescription, but there are various allergy medications that can be bought over the counter. These include steroid nasal sprays, antihistamines, oral and topical decongestants. So an antihistamine like Fexo, for instance, can be bought over the counter, and a prescription is not needed for instance, Oxymist, the decongestant we're talking about. It can be bought over the counter, but it must just be used as instructed. So that's just, just in terms of accessing allergy medication, it is quite easily available. I think the trick is with managing it. I think, as we kind of talked about before, is just understanding how to use it effectively. So, people sometimes, will come to see me and they will describe their allergic condition, and we'll do a skin prick test and we'll see that they're allergic to house dust mite and pollen, for instance. And I will start them on medications, something like a steroid nasal spray and an antihistamine on a daily basis. And I'll say, okay, we're going to do this for 3 months, and then you're going to come back and see me and we'll see how it's going. But you can give me a call before then if you've got any questions. They do brilliantly. They leave, galvanized. They understand why they're getting the allergy, and they understand how to use their medication. And then about 6 weeks down the line, they find that they're doing so well, in fact, that they've hardly got any symptoms. And they sort of forget that the reason they're doing so well is actually they're managing their condition so well. And so they start getting a bit sort of relaxed with the nasal spray, and then they stop using the antihistamines, and then their symptoms sort of ease back in again, and they think, oh, you know what, actually, I realize I'm not using my medication the way I should be using it. And so they sort of start again, but in a piecemeal way, and then they think, oh, this stuff is rubbish. I'm not going to take it because it's not really working. They come back to see me 3 months later, and it's the whole it's that story of, this medication doesn't work. I need something stronger. I need something else. And then we go into the detail, and they work out that actually this is a tough disease to treat because it requires real diligence and consistency, and the management is relentless and boring and quite tiresome because steroids are steroids. They cause problems. If you take steroids orally, you end up with all sorts of side effects. So let's say I gave a patient 60 milligrams of steroids orally as a tablet or as a set of tablets. every day for 3 months, they would have all sorts of problems. They'd develop diabetes and hypertension and psychosis, and they might. I'm just saying that these are some of the potential side effects. And immune suppression, and gain weight, etc.
Yeah.
So we can't give them orally in the long term. So some very clever pharmacologists got together and worked out how to give these medications topically. Instead of having to take them orally, you could take them topically. So if you have eczema, which is essentially inflammation of your skin, you can put it on as a cream. If you have a nasal congestion because you have allergic rhinitis, you can use a nasal spray. So you don't have to take the steroid as an oral dose, but you just spray it onto the nose, and it actually just treats that topical area. And then if you have asthma, you can use an asthma pump. It's exactly the same thing as a nasal spray, but it's just going into the lungs. So all of these are very small doses of steroids, specially designed not to get into the bloodstream, not to cause long-term side effects, but to be able to just ease the inflammation down at the site. Well, because it's such a small dose, and because it, because it's designed not to cause any systemic side effects, it has to be taken every day, and it has to be done very consistently. It has to be done, same time of day every day, and that's tough to do. It's not easy to fit into your day. So patients, they're quite inspired when they first come and see me, and they sort of feel like, I'm going to do this thing, and they are brilliant at it, and they succeed, and then they get a bit slack, and they forget that the reason they succeeded is because they were so diligent. And then when they restart the process, they're not as persistent, and so then they sort of fail to use their medication in the way that they started off. So I think the big take-home message with allergic rhinitis medication, even if you can buy it over the counter, is to learn to take it properly, to really get committed to you're either on it or you're not on it. And if you are on it, realize that it's actually a preventer more than a treater. So you need to actually get in ahead of the symptoms to actually control them properly.
Yeah, I mean, it's like someone who has to take an inhaler every day too. It gives you that daily consistency. And I think, when you realize that even if you're not feeling the symptoms at the moment, it's because you've been treating it and dealing with it.
That is the exact point. That is the exact point. And it is fine if you've been, let's say you have asthma, and you've for the last 5 years you've been beautifully controlled, and actually you haven't had an asthma exacerbation for a whole year, and you're wondering if are you symptomatic anymore at all?
Exactly.
Well, then it might be a time to step down treatment, but that's something to be discussed with your doctor. Say, okay, is the reason that I'm not getting any symptoms anymore because I've gone into a sort of quiescent phase in my disease, or is this just because I'm very diligent and I'm doing a good job? And you might find that they're taking 2 sprays in the morning and 2 sprays in the evening, and it can be, just step down to just 2 sprays in the morning. So just a little step down of the dosage, or it might be that, they were on a combination spray and they could just go onto the steroid alone rather than the combination. So, there is that fluctuation that happens with allergic disease over time during people's lifetimes. So sometimes it is necessary to change dosages or to step medication down, and that's perfectly appropriate. But when you are attacking your medical condition or your allergic condition, it needs to be done with real diligence and consistency, and that's the tough part to do, and that's the part that takes real education.
Yeah, exactly. Okay, we've got one question, and I think you mentioned it, so I just want to make sure that we clarify and answer Candace's question. So Candace was asking, having my diffuser on usually helps me with sinus. Is there a reason for this? And you mentioned the humidifier. So I'm assuming the diffuser would do the same work as the humidifier with helping moisturize. I don't like the M word, the mucous membrane.
So that mucous membrane really does work very hard in its own right to humidify air. So as you breathe air in, it is trying to get the air to the right sort of state to enter the lungs. Your lungs really like warm, humid air. Your lungs constrict up and don't really enjoy being attacked by cold, dry air. So that's what the nose does. It's a big air conditioning unit with, folded mucous membranes. And as the air goes through the nasal passages, it slowly picks up fluid, so it gets humidified and it gets warmed up by the blood by the blood supply to the mucous membrane. And then by the time it reaches the lungs, it's in the right condition for the lungs to feel comfortable accepting that air. Yeah. And using a diffuser or a humidifier would definitely make sinuses or nasal passages feel much more comfortable.
Awesome. No, great. Thank you so much, Candice. Not a problem. She said she joined late. Not a problem. It's actually quite informative, and I think it's great to know as well. Like we said last week, it's always so good to do what you can to care for yourself and to do a few home remedies, and then also partner with your doctor so that you can get the right treatment for you. So thank you, doctor. I appreciate you coming back to us, and I enjoyed having you 2 times in a row. So thank you so much for your time, for your expertise, and for just how you shared your knowledge with us. We really appreciate it. And thank you to CIPLA as well for partnering with us in this. And to all of you over on the CIPLA side, I'll come and check out the comments and see if there's any questions on that side. Thank you so much, everyone on the Jeff side, and have a fantastic evening. And we'll see you again next time.
Thank you. Good night.
Good night.